working in the pediatric ICU in Montreal. In that hospital, we were fully paper-based. So everything paper charting. We did have a little bit of technology integrated in our care, but very minimal. And then with time, I got opportunities to go work in the US. And that was really a transformative experience for me as well. It was a huge shift to have to go work in hospitals using all these different EMR systems. And, as a travel nurse, you're expected to adapt literally in seconds.
Right.
You get on the floor, they show you, there's the bathroom, there's the equipment room, and you go for it. Take care of, intubated babies, and you're let loose. And so that was a really challenging experience as well. But what really transformed my perspective on nursing was just having to navigate all the different EMR systems that I was working with. And while I really continue to love the clinical aspect of nursing, I really became fascinated with technology and how it influenced patient care. Using, EMRs in the pediatric ICU where vitals are changing rapidly and, we have a lot of documentation to do, you really see how having access to all that data and having it organized in a specific way that makes you better understand it and, helps you make the right decisions, it's really impactful. And, sometimes when I was in the ICU, I would see myself as like a data clerk, collecting data and, trying to make sense of it and then analyzing and bringing my findings to physicians, so they can make their decisions. And, the more I worked with EMRs, I realized how my findings, analyzing how different things would affect my patients really influenced decisions. And that was really eye-opening to me to see how much technology really changed my care and my practice. And I was really mind blown by the potential of technology in healthcare. So from that, I became more curious and I decided to pursue my master's in health informatics. And that's basically how I transitioned to the field.